Hi, Dr. Williams. It's so good to have you on today. I'm super excited. Dr. Williams is one of the doctors at Modern Med. She specializes in integrative treatments for gastrointestinal conditions as well as hormones for women and men, and some other things that we've talked about in the past as well. But welcome. Today we're going to be talking about female hormones. It's good to have you.
Yes, it's great to be here. I'm excited to talk about this important topic, diving into hormones and bleeding and cycles. So it's going to be a good one.
Yeah. So today we're going to focus on irregular menstrual cycles. And first of all, we're going to talk about what that is, but also the different types of menstrual irregularities that we can see in practice, and when you should definitely be going to see an OBGYN, and some other information as well. But the way I want to kick this off is just by talking about what is a normal menstrual cycle. And if you've listened to our videos before, we've gone through this, but I think it's important to recap just to set the stage for all the information to follow.
Yep, really important. We often get the menstrual cycle versus the period confused. So I'll dive into that first. So our menstrual cycle is referring to the whole month of our hormone fluctuations. So on average, we're usually referring to like a 28-day cycle. It can vary from that, which I'll talk about in a second. But that is really what the menstrual cycle refers to, versus the period is the amount of days that you are actually bleeding per month. So that's the difference there.
Yeah. So when the doctor says, like, how long is your cycle? They're looking for an answer of like 28,
30
35.
days,
What
yeah.
is what's the normal, what could be the range of like the shortest to the longest cycle that's still considered normal?
Yep. So 24 to 35 days, which I think is really important to distinguish because I think classically we tend to freak out if it's like, oh, I had a 26-day cycle or I have a 26-day cycle pretty consistently. Like, is that abnormal? And it's not. Like 24 to 35 days. So there's pretty wide range there of what is considered normal.
Yeah. Yeah. And in terms of bleeding, the period, what is considered normal for how many days we could be bleeding?
Up to 8 days is considered normal.
Yeah. Okay.
Yeah.
And then in terms of cycles, variations, so some people may have, a 26-day cycle, then they may have a 30-day cycle, and they may kind of like fluctuate around. What's normal for one person to fluctuate from one month to the next?
So it's normal if it's 9 days or less of fluctuation. So like you said, like 24, 30 days, like that's normal. So it would be more like if you had like a 24-day cycle and then a 35-day cycle, and having that wide variation is really where we want to investigate further and see what's going on.
Yeah. Yeah. Okay. And then I want to talk about blood loss, and we'll actually segue into irregularities with this. But what's normal in terms of from, during like the 5 to 7 days that you are having your period, what's a normal amount of blood to lose during that time?
So up to 80 milliliters or 2.7 ounces is the other metric that we can use. So the easiest way that I think to put this into like perspective is using like a menstrual cup.
Yeah.
So an average regular menstrual cup is 1 ounce, sorry, or 30 mLs. So that can really put into perspective of like how much you should be losing throughout the entire cycle.
Right. So throughout the entire cycle, it would be 2.7 ounces. So you're thinking about, two of those plus a little bit. The other thing is a shot as a bartender. So like a shot glass is typically 2 ounces. We think of a shot as 1 ounce of alcohol, but a lot of shot glasses may be a little bit more. So if that's an easier thing to picture for you, but that's throughout the whole menstrual cycle. It's not for every single day. It's throughout the whole,
Mhm.
that whole period is 2.7 ounces. So it's actually not that much blood.
Yeah, it's really not actually.
Yeah.
Yeah.
And then in terms of tampons, if somebody's using tampons, how much, like, if you use one regular tampon, how much blood does that actually even hold, to put it into perspective more?
So that's 5 milliliters of blood for a regular size tampon.
Okay, so you're looking at is it like 16 tampons throughout the whole cycle? regular
Yeah, that
tampons.
sounds about right.
We're getting into
Yeah.
math now. People are
Yeah,
like,
I'm never good at math. But yeah, so I mean, essentially really heavy bleeding, which we'll talk about in a bit, an easy way to kind of look at it is like if you are soaking through a super pad or a tampon in less than 2 hours, that's another good indicator. Or if you're like fully soaking in one day, 6 or more regular tampons. So that's another good way to look at it. That would be
6 or
really
more
heavy.
regular or super in 2 hours or less is considered menorrhagia, heavy bleeding.
Correct.
Yeah, okay. Let's go into the heavy bleeding because that's one of the potential things that we're looking at when we talk about irregular cycles is that maybe your cycles are all 28 days, but you feel like you're actually bleeding a lot more than you should be during your actual period. So we know what's normal. Now let's go into what's abnormal. You already talked about it a little bit, but how common is it? Do you see it a lot? And, when are the times where people should be really making sure they're going to see an OBGYN if it is an issue?
Yeah, so menstrual irregularities in general are very common. 14 to 25% of women report it. So that means up to 1 in 4 women experience it, which is why it's so important that we're talking about this and distinguishing between the different types of things that can really happen and when it is something to investigate further. And so, like you said, heavy cycles is one of the biggest ones that we see, which is called menorrhagia. So that can be really heavy bleeding. That can also be just bleeding for extended periods of time, which would be greater than 8 days.
Hmm.
So as we spoke about a bit, so that would be like soaking through a super tampon in less than 2 hours, or clots that are bigger than a quarter size, changing tampons or pads throughout the night. Those are all signs that you might be bleeding more than you should.
Okay, yeah, you can't make it through the night without having to get up, change, or you're bleeding through a super tampon during the nighttime. And then in terms of other menstrual irregularities, what are the most common ones that you see in practice?
I would say the most common is dysmenorrhea, which
Yeah.
means painful cycles. This is when we have a lot of painful, severe cramps, sometimes even leading to like nausea, vomiting would be a very severe case. But this is really common. 50 to 90% of women report this, at least at some point in their life. And part of it is like a normal process. So when we start to bleed, that is actually caused by prostaglandins, which are chemicals that cause our uterus to contract. So that contraction can be uncomfortable, especially if we have overall more inflammation going on in our body. So usually we see that this is worse when you're younger and can dissipate as you age. Stress also plays a big role with this too.
Yeah. Okay. And it is super, super common. And I like how you differentiated between there's normal discomfort, right, that people
Mhm.
experience, and then there's the level of, okay, this is no longer normal, especially when there's, vomiting involved. How else do you differentiate? Is this normal amount of discomfort or is this abnormal?
Yeah, so some ways I differentiate is, if you have to call on work because of your period, or if you have to lay in bed all day, if you're having to take medications and NSAIDs around the clock, like high doses of it for several days of your cycle, that's also something that would warrant looking into further.
Yeah. Okay. And then there's oligomenorrhea. So when you're not bleeding frequently, right? So you're having fewer menstrual cycles throughout the year. Tell us a little bit about that. And then I'm also going to refer back to, if this is something that you're interested in, to watch the video that we have on PCOS that's available. But you can give us
Yeah.
a little overview too.
Yeah, so these are the infrequent menstrual cycles. So this is when they are greater than 35 days apart. The most common cause of this is PCOS, which is polycystic ovarian syndrome. We did that video on there too, if you want to look into it further. But that's when we have elevated androgens like testosterone that are inhibiting or delaying our ovulation. So that causes the periods to be more separated. And so we have a lot of symptoms that we often see with that, like hirsutism, which is hair growth in places we don't want it, acne, weight gain, and then we can even do a transvaginal ultrasound and see cysts on ovaries as well.
Yeah. Yeah. We see this a lot. This one is another common one that comes
Mhm.
in. Yeah. And a lot of the times there's a lot of things that we can do about that. So I'll just again refer back to the video so we don't have to repeat ourselves there. Um,
Yeah.
and then we have the other side too, where it's like, okay, I'm not having any cycles. I've stopped cycling. And so can you just go first of all between what's the difference between primary and secondary amenorrhea?
Yep. So primary amenorrhea is when you are 16 and still haven't gotten your cycle. So that is something that we want to look into and see what's going on. Why aren't we making the hormones properly? Whereas secondary is, you've had regular cycles, for an extended period of your life. And then for, greater than 6 months, your cycle's poof, gone. And we are like, okay, what's going on here? So that would be secondary.
Yeah. And what are the most common causes that you see for secondary amenorrhea? Because there's some really common ones.
Yeah, so it's what we call functional hypothalamic amenorrhea, which is usually caused if you have a lot of stress, if you're over exercising, under eating. Those are the most common causes. So if we don't have enough of those nutrients to facilitate regular hormone release, then we won't get our cycle.
Yeah, super common in athletes. But also common in the general public where I've seen, even if a woman isn't necessarily a low BMI, you can still see functional hypothalamic amenorrhea, which I think is confusing. Some people are like, oh, I'm a normal
Mhm.
body weight though. But if you went and you lost 10 pounds, especially quickly, then we can see that develop as a loss of period.
Mhm. Yeah, absolutely. And the stress piece too plays a really big role.
Huge role. Yeah. And like the perception of, am I stressed? Or like, I don't feel stressed, but maybe it is stressful is hard to pull apart as well.
Yeah. Yeah. And exercise itself is a stressor, even though it's a beneficial stressor. So I don't think people
Yeah.
always think of it that way.
Right. Right. But if you're exercising a lot, then you have to be fueling your body appropriately. If you get that mismatch in calories
Mhm.
in, calories out, that can be an issue.
Yeah,
Um,
absolutely.
And then we also have the other cause for amenorrhea. We're looking at primary ovarian insufficiency. How is that kind of different than functional hypothalamic amenorrhea?
So this is when you are less than 40 years old, your ovaries stop functioning and you don't get a cycle as a result of that. So it's essentially like an early menopause that
Yeah,
we experience where the ovaries shut down, we don't have enough estrogen or progesterone to cycle anymore.
yeah, yeah. And going back to the functional hypothalamic amenorrhea, the main treatment for that, like how are you going to treat somebody with that? And it's pretty different than primary ovarian insufficiency.
Exactly. So it would be, looking at the cause. So working on making sure that they have enough nutrients, working on a correct exercise regimen for them, stress management, all of that. And I think there's really supportive herbs that can help balance that out too.
Yeah, weight gain if needed as well.
Yeah.
Yeah. And then with spotting between cycles, this is an interesting one. Um, there's a couple different types that you were talking about where you can have like this pattern of spotting versus this pattern of spotting. How do you differentiate those two things?
Yeah, so there's spotting that can happen right before you start actually bleeding for your period. So 1 to 2 days of spotting before your period is actually normal. But if you're spotting for several days before your period, that could be a sign of lower progesterone. Whereas we also see sometimes spotting in between the cycle. So that's something that is really helpful to track and see, okay, well, like when am I spotting? Is it consistently like the same time around every month? I would say the other common time I see spotting would be like right after ovulation. Sometimes
Mhm.
the dip and decrease in estrogen can be pretty significant and cause a little bit of spotting at that time.
Yeah, yeah. And then you were talking about non-cyclical spotting too versus cyclical in terms of like the inflammatory piece, if you can touch on that.
Yeah, so there is like, say if you're like having spotting after intercourse or you're just noticing spotting randomly, that's also something that we want to look into. Like sometimes there's certain like STIs, infections that can contribute to bleeding, and then also like polyps or fibroids can cause bleeding throughout the cycle as well. So that's something we want to look into too.
Yeah. And even bacterial, overgrowth, whether it's BV or Candida fungal infection can sometimes cause that
Yeah.
non-cyclical spotting as well, just because the inflammation that happens with the cervix with that.
Yeah, absolutely. It's a big one.
And then there's obviously medications. So let's just talk about some of the general medications that you may experience any irregularities in your cycle with that are known in research.
Yeah, so the main ones would be steroids, blood thinners, antipsychotics, and anti-seizure medications are well known to cause some irregular bleeding. I would say another big one too is having an IUD or being on certain oral contraceptives. Those can also cause some changes with bleeding, and that would be considered normal.
Yeah. Okay. So we kind of expect it, especially, with certain IUDs where it's like, yeah, you may not get a cycle, and we know that. And then there's also another time when irregular cycles we still consider normal. So we want to differentiate that between what we've been talking about today.
Yeah, so I'd say the two main times would be when you first start menstruating. That's usually between like age 9 and 14. So for the first couple years, you can experience some irregular cycles and periods. The other time is on the other side of the spectrum, which is perimenopause, which is usually around age 45 or older. That's also a time where irregular cycles are completely normal and just part of the experience.
Yeah. Yeah. The two bookends of reproductive health. Um, Anything that we didn't cover that you think would be interesting for us to talk about in the irregular cycles realm today?
Yeah, I think one other important piece would be a cause of menorrhagia, the heavy bleeding, and also dysmenorrhea, the really painful bleeding, is commonly endometriosis or
Mm,
fibroids and polyps. So those are really important things to investigate if you're experiencing those two. That's when our endometrial tissue starts to grow in other places like our ovaries or fallopian tubes. So that's really important and commonly causes a lot of bleeding and pain.
yeah, I'm glad you brought that one up too, because endometriosis is one of the things that overlaps between hormones, endocrine, but also GI. So we see it
Mhm.
all the time in our practice. Can you talk a little bit about that overlap with endometriosis there?
Yeah, so it can be confusing because there's a lot of like bloating that can also happen with endometriosis. And because of the tissue growing in other places, it can really contribute to GI discomfort, changes in bowel movements as well. So often we have to look at the gut microbiome and how that's interacting and playing a role with the endometriosis component as well.
Yeah, it's also a super tough one to diagnose just from the mere fact that it's really like laparoscopic. So you have to go in
Yeah.
to see where the tissue actually is. So it's not an easy diagnosis to make. And it
Mhm.
masks itself as IBS all the time, where it really looks like IBS or like it actually has a huge overlap with SIBO. I don't know if you remember the statistic there, but it's a huge percentage of people with endometriosis have small intestinal bacterial overgrowth as well.
Yeah, I don't remember off the top of my head. I want to say 40%, but I could be wrong.
Yeah, but it's a good amount of those people with endometriosis that also have bloating and stomach
Hmm.
discomfort too.
Yeah.
Um, okay, this was super informative. Anything else before we sign off that you wanted to mention?
I think that we covered a lot of it. I think that's mostly it.
Let's just touch on testing briefly. We've talked about it in the other videos with hormones, and it's going to follow those same things. But say somebody has, any sort of irregularities with their cycle. A lot of the times, OBGYNs are going to be the ones to run this. But in general, what should they be looking for in terms of how to test their hormones? What are like the keynotes to make sure that you're paying attention to?
Yeah, so we really want to make sure that we're testing at the right time of our cycle. So especially when we want to look at estrogen and progesterone, that would be timing, we say about day 19 through 21 or 5 to 7 days after ovulation. So we can look at estrogen and progesterone. Also really important to look at androgens like testosterone, DHT, DHEA. Those are all really important, especially with that PCOS type of picture. We do want to look at like LH and FSH to see how that brain signaling is working to make your hormones. hormones. So there's a lot of things that we can look at from the hormonal standpoint. Another big one actually to look at is a full thyroid panel. So hypo and hyperthyroid can really contribute to dysregulations in our cycle as well. And I
Yeah.
find that's often missed actually.
Yeah, you have to rule out hypothyroidism if they have amenorrhea, but and yeah, most of these things too is going to be something that we look at. Um,
Yeah.
Amazing. Okay,
Mhm.
so if you want to schedule a complimentary call with Dr. Williams, you can do so. It's going to be underneath in YouTube. And if you're on our website, there's going to be a button there as well. She'll talk to you on the phone for 15 minutes, go over what it would be like to work with her, and all the other things. She also has a lot more videos on all the things that she specializes in her bio on her website. So check those out as well. Thank you so much, Dr. Williams. It's good chatting with you.
Thank you. Always a pleasure.